In this video, I'm going to show you a few traction techniques for the cervical spine. So what you're going to do, you're going to have your patient lying supine. You're going to go underneath the cervical spine with your forearm in a supinated position. And then what you're going to do is you're going to rotate or pronate your forearm palm down. And as you do that, you're going to grab some of the skin and the muscle here. So it's going to kind of pull, and you're going to be able to rotate with that. And that's one way to do the traction. And the other is going to be, I'm just going to take my hands, go right under the base of the skull here, and I'm going to pull a little bit of traction that way. You can do this several ways also. You can also do it so that your hand cradles the chin and kind of do that together. A lot of times if the patient has some TMJ issues, I don't like to do that, just my personal preference. So I'm going to show you these two techniques now. The first technique is going to be that taking the forearm and rotating it palm down. So I'm going to go right under Kinsley's neck here. She's going to lie her head back just on my forearm. And then I'm going to try to keep her neutral here. And as I rotate, I don't have to exert a lot of force. And you can see her head moving there. Just an easy way to traction. And you can hold that for 10, 15 seconds, even 30 seconds, just going back and forth. And I complete that for several repetitions, and I do that during each session. This is a technique where I'm going to go underneath her occiput, underneath the base of her skull, and then in the cervical spine. So I've just got my hands there. You have to be careful with a couple of things here. Be careful not to jab with your fingers on her transverse processes or on the spinous processes there. That could be uncomfortable. And also where your thumbs are. You don't want to jab your thumbs into someone's throat or in the side of their head. And also be conscious of ears, earrings, all those types of things. I'm just traction, just pulling. Now, I'm doing this with my elbows bent for a purpose because I wanted you to see how I don't like to do it. So my elbows bent, I'm going to really wear out my biceps like that. So what I like to do is keep the elbows straight and then just lean back with my body and traction her that way. And that does really well, just leaning like that. A nice traction. And then after I finish always with traction, I like to always go and do what I call a neck washout, just a couple of those rolls. That usually feels pretty good to the patient after I've kind of been pulling. So, and you can also combine that with joint mobilizations and manipulations as well. Hope this video helps, guys, and thanks so much for watching.